AFMC is really known.
That this failure will provide ideas.
And also make sure
Doing the office hours.
Hello and welcome into this week's edition of AFMC TV. We're glad you're joining us. Have you noticed Facebook ads or maybe Instagram ads about a new thing called IV drip therapy? And have you often wondered just what exactly is it? Is it safe and does it really work? Well, we're going to answer those questions today. Joining me now is Tiffany Lack. She's an APN over at Natural State Health Center. And Tiffany, you specialize in these IV drip therapies. First of all, thanks for joining us today.
Thank you so much. It's good to be here.
So let's start at the beginning. What is an IV drip therapy?
IV drip therapy is it's an IV, so we put a needle into your arm and leave a catheter behind after we take the needle out and connect it to some IV tubing. IV stands for intravenous, which just means it's going into the vein. And we connect it to a bag of fluids. And those fluids we usually infuse with some sort of a vitamin mixture. Now, the vitamin mixture can be something like just a vitamin C. We might put some magnesium or calcium or something along those lines in there. You might also have something like a headache going on, and we can do an IV infusion specifically for your headache and add some Toradol or some dexamethasone or something like that to us, other medications that might help you recover from whatever it is that you're coming in for. Now, I can't say that we can treat everything or that we can help with everything, but oftentimes a lot of patients come in and say that the IV infusion helps them to recover faster or to prevent infections from happening, things like that. And so the IV definition is just the bag of fluids with nutrients added into it that's infused into your vein.
So about how long does something like this take?
Usually it takes about a half hour to an hour. It really does depend on which one you're getting. Some of them can be injected into your arm. We can do the vitamins as an intramuscular injection, but as an IV infusion, it's going to take about 30 minutes.
Okay. So let's talk about the different types of IV infusions. I've experienced one. I had an immune boosting one that made me feel like $1 million the next day. You guys, I know, offered that, but are there other ones that you offer as well?
Absolutely. Our immune boosting one is one of our most popular. We get a lot of people, especially this time of year, that come in and just want to make sure that their bodies are ready for the viruses that are about to come through, especially coming into flu season and coming into the fall. All of us could use a little extra boost. We also have one that can help you balance your vitamins so that you can respond to anxiety a little bit better. We have one that just replenishes the vitamins that are in your body as it is. Some people call that a Myers cocktail. We have a different name for it, but it's just a good all-around vitamin boost. We have one that helps your body recover from something like heavy weightlifting or from after having an infection or a virus. It helps your body recover from those a little bit faster. We have one that's specifically, I call it the hair of the dog. It's specifically for after you've had a busy night out and you want to come in and you want to get rid of that headache and feel better.
I wondered if there might be a cocktail of sorts for those specific circumstances. I have some friends that do endurance. They are endurance athletes running 100 miles, 50 miles, and I know that they've utilized that as a way to help recover. And you mentioned weightlifting, that is a way that you could use that as well.
Absolutely. It's really popular amongst people that are heavy into sports, like runners and cyclists and things like that. We have one specifically for that population to help them recover or to help them prepare for a long endurance or heavy weightlifting or whatever sport it is that they're in.
So what is it about this mixture that helps? Is it just because it gets into your system a lot quicker than an oral pill of some sort?
It bypasses the gut. So when you take an oral pill or you take a pill by mouth, it has to go through the gut and dissolve and be processed by the bloodstream and the liver or the kidney or whatever it is that wherever that vitamin needs to go. By putting it straight into the IV, we're bypassing all of that, and your body is able to utilize it a lot better.
And then how often would someone utilize this service? Is it a one and done, or do you come back 3 times a week, or once a week?
It really does depend on why you're coming in. So let's say that you had too much fun last night and you want to come in for the hair of the dog. You might just get that one and be done, because you're not likely to have a hangover every single day. But someone that's coming in with migraines, we might treat them once a week for a month and then try to space it out after that. And it's really going to be up to the patient as to how often we're going to get it at that point, because if they're able to keep their migraine away for 2 weeks, then we'll only do it every 2 weeks. If they're able to keep it away for a month, then we'll only do it every month, until eventually they don't need it anymore. Immune boosting, things like that. I've got a lot of people that come in just once a month, just to make sure that their body is ready to go. When people come in after a virus or an infection and they want to do that recovery, they might do it just the once, or do it 2 times in a week, or once a week for 2 weeks in a row, and then be finished with it after that. A lot of my endurance athletes will come in just before an event or just after an event and do it for that point. So it really does depend on what you're treating or what your goals are. I'll work with each patient as they come in. I'm the sole provider here. And so it's me personally that provides these services. I meet with every single person before we get started and learn what your goals are and how I can help you meet those goals. And then we'll develop a plan together for each person individually.
You mentioned also, in addition to IV treatments, there is an injectable treatment as well.
There are some injectable treatments depending on what your goals are. So like an immune boosting one, we can do an intramuscular injection with some immune boosting vitamins. And we just bypass the IV fluids at that point. You just pop on in, we'll do a quick injection, and then you're on your way. It's really nice for those working people that are coming in that just need to get something and get on with their life. But they want to make sure that their vitamins are where they need to be so that they can respond to the environment appropriately.
A little bit of help never hurt anybody, right?
Absolutely.
Real quickly, let's let everybody know where you're located, and might this be something that insurance covers, or generally not?
I wish insurance would cover it. Being a vitamin, insurance does not cover it. And so it is a cash pay option. We do have some discounts available for people that purchase packages. And we can talk about that whenever you come in. We are at the corner of Sam Peck and Cantrell at 12911 Cantrell Road, Suite 4. So we're right behind the Starbucks on Cantrell. And you can reach us at 501-224-1224, and we'll get you an appointment.
That, I'll tell you, that Starbucks on Cantrell, they have an IV there too for some people. It comes in the form of a cup, but it's an IV of caffeine nonetheless.
That's right.
Tiffany,
you can go get your caffeine and then come hang out with me for a half hour or so while it's getting into your system.
That sounds good. Tiffany, thank you so much for joining us today.
Thank you so much. I really appreciate it.
Recently, the FDA has approved over-the-counter hearing aids. So what does this mean for the general public? Joining us today is Dr. Mary Chatelain from Pinnacle Hearing. Thank you for coming in.
Thanks for having me.
So what does this news mean? I mean, can anyone now get hearing aids?
So yes, so the FDA released guidelines on hearing aids, on over-the-counter hearing aids, and these are supposed to be released, I believe, mid-October. Okay. This is something so new. So the hearing aids that we're most familiar with are prescription hearing aids. Yep. So those are the kind of hearing aids that you're going to get from an audiologist or a hearing instrument specialist. Those are going to be custom fit to your ears. So the FDA has actually created this whole new category of over-the-counter hearing aids. Okay. And these are going to be the ones that you can purchase online, you can purchase at a store without seeing a doctor, without getting a hearing evaluation, similar to readers, eyeglasses. Okay. Very similar. So the great thing about this, and what I'm so excited about, is hearing loss has always been such a taboo subject. You know, people don't want to talk about their issues with hearing or wearing a hearing aid because it's always perceived of, oh, that's what happens when I get old. Well, no, that's what happens when you have hearing loss. So I am so excited about how this buzz of OTC has really just created so many questions in my field, and it has people talking about hearing loss.
So one of the first questions I would have is, how would I know if it's actually going to work for me? And do I run the risk of doing more damage if I got the wrong thing?
So that is definitely a concern when it comes to OTCs. And these OTC guidelines are just being written. Yeah. All these OTCs are just coming on the market. So we're getting flooded with all this new technology over the counter. So there are a lot of questions as what's going to happen? Is this really going to be the best for the patient? Mm-hmm. So there are people that OTC devices are strongly not recommended for. So children, anyone under the age of 18, someone that has active drainage coming out of their ears, someone with tinnitus, which is ringing in the ears, patients who have dizziness, patients who have asymmetrical hearing losses, and patients who have cognitive issues. So those are going to be people definitely steer clear of OTCs. So you do run a risk with purchasing OTCs and not really knowing, is this the best thing for me? Mm-hmm. OTCs are recommended for people who have mild to moderate hearing loss. There's going to be no verification. There is going to be no way to know, is this actually accurate for my hearing loss? Mm-hmm. They're not going to be able to be custom fit to your ears. It's going to be kind of a one size fits all. Mm-hmm. And also there is not going to be any follow-up care provided and anyone really guiding you through that process. So that is why, I'm excited about OTC. I'm excited about all the buzz. And I think that it is going to help our profession really educate the consumer more. The average patient, by the time hearing loss is causing an issue and they actually get in to see us, they wait 7 years.
Wow.
That's a long time.
That's a long, yeah.
And so I'm excited because I hope that OTCs are going to be kind of a stepping stone to start educating that consumer, where we're going to get people who are not waiting 7 years to treat their hearing loss. And I'm hoping we can at least cut that in half. Okay. The average person who would benefit from hearing aids, so anyone under the age of 70 that would benefit from wearing a hearing aid, right now only about 13% of those people are wearing hearing aids.
That's not much.
For individuals 70 and above, it's a little bit more, but it's still only 30%.
Yeah.
So, we're definitely not treating as many people as we should. Right. And as we can. And so the OTC is definitely, like I said, it's going to provide a stepping stone where there's going to be more access. It's definitely going to be more affordable. With that, it's not going to be for everybody. Mm-hmm. I think the majority of our patients, again, it could be a stepping stone, but I don't think it's going to be the end game. Mm-hmm. Once they understand how crucial their hearing is and how much amplification can help them, they're going to want to be in a prescriptive hearing device.
One that is tailored for them.
Yes. Mm-hmm. So not only do we tailor the programming, but we're also going to tailor the fit. There are ways where we can custom make that to your ear, so it fits securely. It's not falling off. You're not concerned about, do I have this in right? Mm-hmm. So I really feel like the prescription hearing aid is definitely still going to be our go-to for the majority of our patients. Again, I think there's a place for the OTC devices, but in general, when you get a prescription device, the reason they are so expensive, people think that, why am I paying this much for a device? Yeah. It's not just the device. This is basically a computer you are wearing on your ear. Whenever we fit a patient, we are going to do real ear measurements. We're going to do verification to make sure, okay, is this hearing aid working for their hearing loss? Mm-hmm. We're going to be able to make specific adjustments for the frequencies they have hearing loss. There is going to be speech processing features and fine tuning that we are able to put in those prescription devices. Also, warranties. Most hearing aids that we fit are going to come with a 3 to 4 year warranty. Right now on OTCs, there's no regulation on that. So, we know how computers are. That's what you're purchasing. You want to make sure that there is a warranty on that, and there's also somebody to guide you through that process. With our hearing aids, we also provide, follow-up appointments, cleaning checks. We are walking through a patient on that journey to hearing better. It's not just here's a device, go home and figure it out. And, we've had some type of OTC hearing aids that have been available, whether they're mail order. We've had that for the past few years.
Been around,
yeah. And I tell you, it is so disheartening. I would say 90% of the patients I see that got something like that, it doesn't work. They get it in the mail. They're not sure how to use it. They don't have anyone to help guide them through that. And so, again, one of the reasons that there is that cost on hearing aids when you go see a professional is because you're getting a bundled service. You're getting the hearing aid, but you're getting all these other services and the warranty included for 3 years. And so that way, if you have an issue with the computer you're wearing on your ear, which more than likely you're going to, you've got somebody to walk you through the process and help you, where you're not trying to mail it back to someone in another country or a few states away to help you.
And I think that's a great point that you make, that these that will be coming over the counter, they are a one-size-fits-all. They're not going to be tailored or customed to your ear, to your amount of hearing loss. They just aren't.
Yes.
And so that's could a person do more damage by getting a hearing aid over the counter that didn't fit right, or the frequency wasn't right? Could they end up doing more damage where later on down the road?
Definitely, there is the possibility of that. And again, there are certain design elements that the OTC is required to have, but for it to know, okay, it actually works with this person's ear, there's going to be no way to know that. So yes, there could be more damage. A concern is, okay, somebody gets that and it doesn't work for them, and they say, well, I tried a hearing aid and it doesn't work, and they kind of just give up, other than getting what custom they need from a prescription hearing aid. So there definitely are concerns about that.
Okay. Well, Dr. Mary, thank you for coming in and helping us kind of navigate this. And it'll be interesting to see how this plays out over the next couple of years, couple of weeks as it gets rolled out.
Oh, definitely, definitely. Sure. And what I recommend is if you have yourself or you have a family member that is experiencing hearing loss, definitely get them in, get their hearing evaluation checked from a professional. Typically, insurance is going to cover this. If not, the out-of-pocket is not going to be huge, to at least then get a professional opinion of what type of hearing aid is recommended. Is it something that, you could try OTC, or is this something that is more intense and needs more of a prescription hearing aid?
Sounds good. Okay, thank you.
Thank you.
And thank you so much for joining us this week. We'll see you back here next week for more AFMC TV.